Hello, my YouTube family. This is Dr. Lee, and I'm back again with another one of my videos. And today, we will be coming from Credentia, who's also known as Pearson View, but it's Credentia is the testing agency. And I'm going to be doing catheter care. I'm sorry, not catheter care. I'm going to do that. Provide perineal care for a female. Provide perineal care for a female. And this is skill number 21. Okay, so with that, I'm going to go ahead on and get started. And at the end, we'll talk about the different steps. Okay, here we go. Good morning, Miss Mary. How are you doing? My name is Dr. Lee, and I'm going to be your CNA for today, and I'm here to get you cleaned up in your private area. So a lot of time, I just tell the client private area instead of saying perineal care, but we know that's cleaning them up in the private area in the front, and then also turning the patient to the side and getting their bottoms. Okay, so Miss Mary will be doing that. I'm going to pull your curtain to provide for privacy. I'll go wash my hands, get my supplies, and I'll be right back, okay? Great. So I will look at the evaluator and say I'm washing my hands. So the supplies for this skill, I'm gonna get a bath blanket. I'm gonna get at least 2 of my large bath towels and 4 washcloths, soap, and a basin, okay? So that would be somewhere in the area, maybe on a table or somewhere, but you would get your supplies and bring it over. So I have my table over here. I'm gonna put my supplies on my table. Also have a pair of gloves and my bath basin. For the perineal area, I'll probably do maybe about 1/4 of a basin full of water. I'm gonna turn the camera so you can see me when I get my water. Now, if you notice, after I spoke with Miss Mary, told her what I was gonna do, I washed my hands, so my hands are clean. I don't wanna turn the water faucet on with my clean hands, so I'm gonna take a paper towel to turn the water faucet on. I'll take this paper towel and put it in the trash. Now, it's important at this point that I test the water, and then once I go to the patient, I'll have the patient test the water. So I can look at the evaluator and say, I'm testing the water. My hand is under the water. And I'll say the water feels comfortable to me to put on the patient. Now I'm gonna get my basin of water. I put in about 1/4 of a basin full of water. Okay. I'm going to turn the water off again with the paper towel because my hands are clean and the water faucet handles are dirty. I don't want to contaminate my hands. All right. And I like to bring an extra paper towel over to the patient for the patient to dry his or her hands with. Okay, I'm gonna turn my camera so you can see me over here do the procedure. Okay. Okay, Miss Mary, I've already tested the water. Can I get you to test the water for me? Okay, let me put it right here by you. This skill will be done on a mannequin during the testing period for you. So I'm going to put the mannequin hands in the water. Is that comfortable for you, Miss Mary? Great. So I'm talking to the patient. Good job. So let me go ahead on and move this out the way. Okay, Miss Mary, what I'm going to do here I'm going to go ahead on and put on my gloves. Now the rule with testing is that the gloves are on before you start washing. I like to go ahead and put my gloves on in the beginning, but you can put your gloves on at any point as long as you put them on before you start putting the soap and water on the client. So I just put mine on at this time. Okay, now I have to keep the patient covered in order to maintain privacy. So I'm going to put the bath blanket at the foot of the bed and cover up the legs from the knee down, and I'll bring her top sheet up to the pelvic area so that she stays covered at the top. In this manner, the only thing that is left uncovered, and this is important, is between the knee and the hip. Everything else will stay covered. Okay, Miss Mary, I'm going to be bringing your top sheet up to your pelvic area, okay? But we're going to keep you covered except for that area. So I'm going to make sure that the feet is covered with the bath blanket. And I'm going to take the top sheet and her gown and bring it up to the waist area. Now I want to make sure that you can see what I'm doing, so let me bring the camera down a little bit. Okay, so the only thing that's going to be uncovered is from the knee to the hip. Everything else needs to be covered up. Okay, I'm going to take a linen protector, which this is just a bath towel, and I fold it in half, and this is what I'm going to put under the patient's hip to keep the bed from getting wet. So Miss Mary, if I can get you to raise your hip up, we're going to put this linen protector up under you, okay? And I need to make sure that both buttocks is under the linen protector. So at this point, I'm ready to start. I'm just going to go ahead and put my dry towel here so I'll have it. I have 4 washcloths in my bath basin. I'll take my first one. I'm going to wring out the excess water and put soap on the washcloth. Okay, so I have the soap here. I'm going to massage it into the towel. And I like to fold the towel in half and then in half again, okay? This way I can use a new area of the washcloth for each stroke. So the areas that I'm going to be cleaning is on the inside of one labia, straight down the middle, and then the inside of the opposite labia. The folded part of the towel I hold between my thumb and index finger. So I'm going to take one part of the towel, and on the inside of one labia, I'm going to wipe down from top to bottom. I'm going to take that part that I just wiped with and fold it out of the way. Fold it out of the way. So now I have a new area of the washcloth. I'm going to clean the opposite labia, inside labia, top to bottom. All right. And then the third part of the towel, I'm going to go straight down the middle, top to bottom. All right. Now I'm through with this. I can just put this over to the side. I cannot reuse it. I'm going to get my second washcloth. I brought 4. And in the same manner, I'm going to wipe the soap away. So I'm going to take the towel, fold it in half, and then in half again. Okay? Inside of one labia, top to bottom, fold that out the way. Inside of the opposite labia, top to bottom, fold that part away. and then straight down the middle, top to bottom. I cannot reuse this towel. So now I have washed, I have rinsed. What's left for me to do? To dry. So I just kind of put it here over the private area and just pat dry down. So I'm just doing like this in that private area. Okay? So now that has been done, I'm gonna fold the towel inside out because now I need to get the buttocks. So Miss Mary, if you can turn, so that they can see what I'm doing, I'm gonna turn you toward me. Normally I would turn you the opposite direction, but I think they can see your buttocks better at this side here. Let me get it where you can see it, okay? And she's still laying on her towel, okay? I have 2 washcloths left. I'm gonna take my 3rd washcloth and I'm going to put soap on the towel. I'm going to massage it in. I'm making sure that she's a safe way. She's not all the way on the edge of the bed. It's not required that you put the side rails up for this skill, although some people do, but she's a safe way from the edge of the bed. So I'm going to take my first towel part. I'm going to go from the rectum straight up the back. I'm going to fold that towel, that part that I just used, away. Now I'm going to get one butt cheek and I'm wiping from the bottom up. Okay? And then we'll get the 3rd butt cheek from the bottom up. Okay, so we're hoping that that makes sense to you. I have 1 washcloth left. I'm going to wring the water out of that one. Now I need to wipe the soap away, so I'm going to fold my towel and then fold my towel in half again. I'm going to start from the crack, the center, from the rectum, go straight up. Fold my towel. I'll get 1 cheek, fold my towel, and then the other cheek. So the last thing for me to do, because I have washed, I have rinsed, would be to dry that area. So I'm going to pat dry. Okay? Now I'm pretty much through with that part. I'm going to remember to take the towel from up under the patient that she was laying on. Miss Mary, if we can go ahead on and get you laying on your back. I'm going to take this towel from up under you and we're going to go ahead on and cover you back up. I'm going to take the bath blanket that I brought to you, and now only thing I have to do is start putting this up, empty my water, and then I'll come back and do my closing with my patient. So these dry things will go into the dry linen container. Make sure you keep it so that it's not on your clothing. The wet things will go into the wet linen container. My lotion and my soap I'm going to bring over. I'm going to kind of tilt the table so you can see where I'm going. Okay? All right, so the paper that the client used to dry the hands is going to go in the trash. This here is the designated dirty supply area, so I'm going to put the soap there that I use. The bath basin I have to empty, rinse, and dry. So 3 things I have to do with that. Because my hands are dirty, I just got through cleaning the patient in the private area, I can go ahead and turn the water on when I need it, but I'm going to pour out the dirty water. I'm going to rinse. I'm going to pour the rinse water into the sink. Empty, rinse, and now I need to dry the basin. Okay? And make sure you dry front, inside, and outside of the basin. This will go into the designated dirty supply area. At this point, I put up all of my dirty things. I can take my gloves off. And remember, every time you take your gloves off, you have to wash your hands. So as soon as I put the gloves in the trash, I'll say I'm washing my hands. Now with my clean hands, I can go back to my client and kind of let them know I'm getting ready to go. So Miss Mary, I'm through cleaning you up in your private area. I want to give you the call light. You can push the red button if you need to get a hold of me. All right, is there anything I can do for you before I go? You good? Okay, I'm going to open the curtain back up. And at this point, I'm going to look at my evaluator. You can kind of make sure you've done everything that you needed to do. You want to go back over it in your head. If you feel comfortable, look at the evaluator and say, I am through with my skill. And then the grading stops. But let's go ahead on. I'm going to bring this down just a tad. So let's go ahead on and talk about this skill. So we're doing skill number 21, which is perineal care for a female. And this one has 20 steps on it, okay? So step 1 and 2 is when I came in, knocked on the door, told the patient who I was and what it is I wanted to do. Number 3 gives me an order for doing something. Number 3 says, before washing, checks water temperature for safety and comfort. And I have to ask the patient to do it. So we did that in the beginning. I checked the water at the sink. When I came over to the patient, the first thing I did was had the patient put their hand in the water and check the water. Number 4, puts on clean gloves. Again, I have an order. It says before washing perineal area. So that's what I was seeing when I was going over, when I was teaching this skill. You can put your gloves on as soon as you come back, when you put in the bath blanket over the patient. You can put your gloves on when you go get the water. We don't care. But if you want to pass this skill, the gloves need to be on before you put that soap and water on the patient, because number 4 says puts on clean gloves before washing the perineal area. Number 5, places a pad or linen protector under the perineal area, including the buttocks, before washing. So I used the bath towel, and I showed you how I folded the bath towel in half and put it under the person and made sure that both buttocks was on that bath towel. The purpose for that is to make sure that the bed stays dry while you are washing the patient, because you don't want to wash the patient and then leave the patient laying on a damp bottom sheet. Okay, that's not going to be comfortable. Now, number 6, expose the perineal area. Now, the state gives you instructions on what do they mean, what do I want open. Everything else has to be covered. So if you read number 6, it says exposes perineal area, only exposing between the hips and the knee. So I put the bath blanket on, I stopped at the knee. I took the top sheet, we went to the pelvic area. This way, the only thing that was open was between the knee and the pelvic area. So that's step number 6, and it's important that we do that. Number 7, apply soap to a wet washcloth. So in the beginning, I put all of my washcloths in the bath basin so that they are wet. I did not put soap in the bath basin. That is a no-no, okay? Because if you put soap in the bath basin, when you get ready to rinse, you're rinsing with soapy water, not just plain clean water, okay? 8 and 9 are my critical steps for Credentia. So what does that mean when it's bolded and we say a critical step? What it means is that if we don't do it, or if you do it incorrectly, it's an automatic flunk. No, I don't care how well you did the other steps, but 8 and 9, you mess up there, you flunk the whole skill. Okay, so let's break down 8 and 9. So number 8 says, washes the genital area moving from front to back. That means that the evaluator will be looking to see your hand movement. This is the front of the person, back would be going toward the back. So your hand should always go down from front to back. So they will look for your hand movement with this skill. And then it says, while using a clean area of the washcloth for each stroke. So every time I went to clean the patient, I folded my towel over or flipped my towel over so that every stroke was a clean area of the washcloth. Number 9, stressing the same thing. When you go to rinse the soap off the patient, you have to follow that same process from top to bottom. If you do more than one stroke, you have to use a clean area of the washcloth for each stroke. Now, you don't have to do 3 strokes like I did. You can just do 1 stroke, because Credentia with the state does not tell us how many strokes to do. They're watching your technique. So if you just want to go soap 1 time top to bottom, put that towel away, rinse 1 time top to bottom, put that towel away, and then dry, that's perfectly acceptable. Number 10 says to dry the genital area from front to back with a dry cloth, towel, or washcloth. So when you go to dry, we don't care what you dry with. It can be a washcloth or it can be the big towel, all right? Number 11, after washing the genital area, turn to the side, then washes the rectal area, moving from front to back using a clean area of the washcloth for each stroke. You have to turn the patient to the side in order to get the bottom. Okay, and when you do the bottom, there are 3 areas that we have to do to the bottom. I like to say butt cheek, crack, butt cheek. I don't care what order you go in. You can go crack, butt, or butt cheek, crack, butt cheek, but you got to hit all 3 areas. Now, with the buttocks, you want to clean up, because if you clean down, you're going toward the front private area. And if it's with a woman, that can cause the person to have bladder infections. So make sure, you know, your mother probably taught you clean up, not down. So that's number 11. Number 12 tells us to rinse the soap off in the same manner, and 13 tells us to dry. And 14, believe it or not, tells us don't just leave the patient on the side, do what? Reposition the patient. So we did that. Now, after we've done all of that, we're ready for the closing part. So 15 says to empty, rinse, and dry the basin. So that's those 3 things that we talked about. 17 tells us to dispose of the linen into the soiled linen container. 18, avoid contact with candidate clothing with the used linen, so I don't want to put it on me and hold it tight. 19, remove my gloves and put it in the waste container. And then this is where sometimes people mess up. As soon as you take the gloves off, you have to do what? Wash your hands. And then number 20, give the patient the signal device. Okay, so I hope this video was very clear. If you have any questions, leave them in the comment section below. And please subscribe. It helps me to put more videos out on YouTube like this. So once again, my name is Dr. Lee, and this was the skill providing perineal care to a female patient, skill number 21. And this skill, during your testing time, we'll be doing on a mannequin. All right, so I will see you in the next video. Goodbye.